But since this is a virtual presentation, I'm very happy to be able to take my mask off and talk with you. The other thing this time of year is important for is getting your flu shot. So not only do we have the COVID pandemic going on, but we're also entering flu season. My name is Louise Blasius, and I'm the Director of Human Services here at McKenzie Health System. I'm also very pleased to say that I'm a certified Medicare Medicaid counselor. This is a program sponsored by the State Area Agency on Aging and locally for our 10 counties, Region 7 Area Agency on Aging. They do the initial training and they do annual training, and they're available for resources and questions and answers if needed. The reason why this Medicare program is coming to you right now is because it's open enrollment season. Open enrollment begins October 15th and extends to December 7th. This is the time of year you can change your Medicare health or drug coverage if you want to, but it's not necessary. Everybody who has a drug plan gets a book in the mail called a formulary with all of the medications listed in it. One should check that the medications that are prescribed for you are on this list. And if it is, and you find the cost affordable, you can keep with that. If you'd like to switch drug plans, this is the time to do it. October 15th through December 7th. And you may change your drug plan every year if you wanted to without any penalty. It's also important for me to note to you that every year, this time of year, the Medicare puts out the new edition of Medicare and You. So I have the 2021 edition for reference right now, and those on Medicare should be getting this in the mail, or you can call Medicare at 1-800-MEDICARE to request one, or when Social Security offices are open, they have it available to you. Basically, people have two choices when it comes to Medicare. They can sign up for Original Medicare when they're eligible. That would be 2 years after onset of disability, or just 3 months before or 3 months after their 65th birthday. Most people get Medicare Part A without any premium costs. And then Medicare also has a Part B, which covers outpatient services. Part A covers inpatient care generally, and Part B, outpatient care. Then most people like to add a Part D, or that's a drug plan, and that has a separate fee. And Sanilac Pharmacy will help people find a drug plan. I will do that here at McKenzie Hospital. And then the Medicare Medicaid program can also help people. And then most also seek to find a supplemental program, insurance, which covers what Medicare doesn't. And I'll go over some of the co-pays and deductibles that are in Medicare. The other option people have is signing up for a Medicare Advantage plan. Most Medicare Advantage plans are all-inclusive. They have to include what's covered by Medicare Part A and B. They usually cover a drug plan, and sometimes they have extra benefits such as hearing aids or dental or vision. And the cost for this varies by the Advantage plan that one chooses. With original Medicare, you have the A, the B, the D for drugs, and a supplemental plan to pick up what's not covered by A and B. And you might say, well, which is better for me? And everybody needs to evaluate that for themselves. Medicare has made significant strides in making their Medicare.gov webpage more understandable and more easy to use for seniors. And you can call the Michigan Medicare Medicaid program or myself for assistance with that as well. But with original Medicare, you can go to any hospital or any participating doctor. You don't need a referral for these services. If you choose an Advantage plan, if you choose an HMO Advantage plan, you need a referral to specialists. If you choose a Medicare Advantage PPO plan, that's usually not necessary to do that. And what's most important, if you switch away from original Medicare, is knowing that your doctor, your hospital, and maybe even your local nursing home participates in that plan. It's very important to know that. Now, if a person signed up for a Medicare Advantage plan, they may also change Advantage plans or switch back to original Medicare, and those dates for doing that are January 1st to March 31st. But what's very, very important to know is if you switch back to original Medicare after having a Medicare Advantage plan and you want to pick up a supplemental plan, you will be charged on pre-existing conditions. And I think most of us have pre-existing conditions, so it can be very costly to pick up a supplemental plan at this point in time, and people may not want to switch back. So in the beginning, when you first sign up, it's important to weigh your choices and your options. Now, for original Medicare, they have made some wonderful new changes which are referenced in the 2021 book. Medicare.gov has all of the latest information on the coronavirus. Great place to check what's going on and how to protect yourself. They have also made strides for lower out-of-pocket costs for insulin. People with end-stage renal disease may also choose the Medicare Advantage plan. And that's new, to be able to do that with end-stage renal disease. Acupuncture for back pain is also new. And then with the burst of the pandemic, telehealth and virtual services have been authorized by original Medicare. And you want to compare your health care providers and services as you decide between original Medicare and the Medicare Advantage plans. There are some terms that I think we all need to understand when it comes to our insurance. There is the co-insurance, and that is the amount you pay for services after you pay deductibles. So the typical co-insurance for Medicare Part B is 20%. Medicare Part B only covers 80% of outpatient services, and the individual is responsible for the 20%. That's why a supplemental plan is a good idea. There's also a co-payment, what you pay for a service. So if I go to a doctor, that might be a $10 copay or a $20 copay, depending on the set amount that is established. A deductible is how much you have to pay before Medicare fully kicks in. And sometimes people have trouble paying all of these costs. So there are Medicare Savings programs. And Medicare Savings will pay your Medicare premiums for you if you're eligible. Medicare Savings has 4 ways they can help. The first is that an individual is full out eligible for Medicaid, and they're called dual eligible. And an estimate how much a single person could make and still get Medicaid is $1,060, or a married couple, $1,430. And then there's a limit on assets, $2,000 if you're single, $3,000 if you're eligible. Another program that helps is the Qualified Medicare Beneficiary, QMB, and that's affectionately called QMB. And QMB will pay for the Medicare B premium and your Part A and B deductibles. And eligible people for that have similar incomes to Medicaid, $1,061 estimate for single, $1,430 estimate for married, but your assets can be greater, $7,730 for single and $11,600 for married people. Then there's specified limited Medicare beneficiaries, SLMB, or affectionately termed SLMB, and that will cover people at 120% of federal poverty. And it pays for the Medicare Part B premium, and once the Medicaid once the Medicare deductible is met, then a Medicaid card is issued. And again, income goes up. For a single person, $1,296 estimate, and married, $1,744 estimate. And then there's ALMB, or additional low-income Medicare benefits, and it helps with Medicare B premiums if a person is disabled but has been able to return to part-time work, and income levels do vary with that. It's important to sign up for Medicare during your initial eligibility. And the exception to that is if you have qualified health insurance. If you have credible health insurance from your employer or your spouse's employer, you may delay signing up for Medicare A and B if you like. If you totally don't sign up for Medicare Part B when you should have, then you can only sign up for Medicare Part B between January 1st and March 31st, and it doesn't become effective until July. Medicaid is a federal program but managed at a state level, and people apply for Medicaid through the Department of Health and Human Services, and that is also if you need the extra help as in Quimby or Slimby or Allenby. And then for people who aren't eligible for Medicare because they're still working but they don't have insurance, they can go to the marketplace and look for coverage there. And we commonly hear that called Obamacare. There is also extra help for medications. And if you're a single person having annual income less than $19,140 and you have assets less than $13,000 estimate, you could get help paying your drug premium. If you're married and you're making less than $25,800 estimate, and you have less than $26,000 in assets, savings, checking, IRAs, you could also get help paying your Medicare drug premium. And again, the Medicare Medicaid program can be called for help, or I can be contacted here at the hospital for help as well. For those people who want to sign up for a supplemental plan, that's reviewed in the Medicare and You book, and it goes through all of the supplemental plans that there are. There's plans A, B, C, D, F, G, K, L, M, and N. Now, what's unique about this is all of these Medigap plans must offer the same services, and you'll want to look at what those services include. The only difference between the Medigap plans, like all A plans are the same, and the only difference is the premium. So it pays to be a good shopper and check out the costs for the different Medigap plans. Another thing that's been making national news is the uptick in Medicare fraud, and we all have to be vigilant on that. There's a Medicare fraud. Common ones are durable medical equipment and genetic testing, where essentially a salesperson calls a senior on the telephone and convinces them that they need this back brace, or they would benefit from getting this genetic testing, and they send this to them. The script is written by an out-of-state doctor. It's often supplied by an out-of-state company, and it's usually low-quality, durable medical equipment. So beware, don't say yes on the telephone. If you need a back brace, if you want genetic testing, talk to your physician about that. And now there's even Medicare hospice scams where you get enrolled in hospice, you don't realize it, and then you go to the emergency room and they say, well, you're under hospice care, and it's a surprise to the individual. I have also had seniors who have had encounters with unscrupulous salesmen. They get people to sign up for policies. Last month, I had someone sign up for a policy. Not only does our hospital not have a provider, there was no provider in Sanilac County. Fortunately, with the assistance of our care coordinators, we were able to get this person back to her original Medicare and Medicaid. If you suspect fraud, it's important to call the Michigan Medicare Medicaid Assistance Program at 1-800-276-2137. Again, that's 800-276-2137, or Medicare can be called at 1-800-MEDICARE. I love that number because it's easy to memorize. If you've got a question about your Medicare, call them, 1-800-MEDICARE. There are penalties for signing up late as well. If you sign up late for Medicare, there is a 10% increase in your premium for every 12 months that you didn't sign up. This penalty is a lifetime penalty, but sometimes if people are eligible for extra help, like the Quimby or the Slimby I mentioned, then the penalty can be waived because a person is able to go through Medicaid and get this extra service. I would like to invite interested community members who watch this and they have questions to please call me at McKenzie Hospital. I'm happy to be of help. My direct line is 810-648-6181. And if you lose my direct line, just call McKenzie Hospital at 810-648-3770 and ask for the social worker. Thank you. It's very confusing to understand all of these details about Medicare, and the Medicare Medicaid Assistance Program is here to help, and McKenzie Hospital is here to help, and we invite your calls. Thank you. Stay well, stay safe, wear your mask, wash your hands frequently, social distance, and get your flu shot.